The views and opinions expressed on this program are those of the participants and do not reflect the views of BronxNet or the program underwriters.
BronxNet. Your voice, your views, your vision.
Good evening. I am Errol Schneer, Bronx Lebanon Hospital Center's Vice President of Planning, Marketing, and Public Relations, your co-host for tonight's HealthBeat television program. We welcome you, our many viewers, to HealthBeat, and as always, encourage you to continue participating in the program by calling 718-960-7241 with any questions you may have. That's 718-960-7241. And we promise to do our very best to keep you medically informed and healthy by discussing the topics that are of interest to you. Please tune in every Monday evening from 6:30 to 7 p.m. on Channel 67. And you can also find out more information about Bronx Lebanon and its many community services online at our website, bronxcare.org. Tonight, my co-host, Dr. Milton Gums, Bronx Lebanon's Vice President and Medical Director, and I will be discussing childhood obesity, a problem of increasing concern in our Bronx community.
Yes, Errol. Recent statistics have indicated that 1 in 3 American children is overweight. Additionally, 50% of adult obesity can be traced to childhood problems within this area. Joining us this evening is Dr. Peter Sherman, Chairman of Pediatrics at Bronx Lebanon Hospital Center. Dr. Sherman is a highly experienced pediatrician that has devoted his entire professional career to addressing the health needs of children and adolescents. He has also authored numerous articles on a wide range of pediatric issues and is frequently called on to provide lectures at local and national forums. Welcome.
Thank you.
Now, Dr. Sherman, before we hear from you, our panelists, or our viewers, let me first ask you, what is the general overview of your pediatric department?
We have a pediatric department at Bronx Lebanon Hospital with a multitude of services. We have a very busy emergency room that is run 24/7. We have a inpatient unit with 20 inpatient beds, and unusual for a hospital, community hospital, we have an intensive care unit with 5 beds. So we can take care of very, very sick kids from the ED up to our inpatient floor. We have a large array of specialty services in pediatrics, such as neurology, nephrology, pulmonary, experts in obesity, in diabetes. And we also have a large network of outpatient clinics throughout the Bronx with excellent doctors who provide general care.
Now, moving on to this evening's topic, Dr. Sherman, can you describe for our viewers the childhood obesity problem as it exists in the Bronx, and is it getting worse?
It would be hard to not be alive and not have heard about obesity. It's a tremendous problem in this country, as our viewers are well aware, with up to 50% of adults being obese. Approximately about a third of kids are obese, and unfortunately, the Bronx has one of the highest rates of obesity in New York City, so it's a tremendous problem. The good news, though, in the last report from the federal government that monitors this, the obesity rates in the country with kids went down a little bit, meaning like 1%. So we may be making a very slight headway in this problem.
Now, expanding on Dr. Gums' question, what types of programs do you now have in place that our community can take advantage of?
In addressing obesity, we are rolling out a very extensive obesity program for pediatrics.
Right.
I recently hired a pediatrician who's a specialist in that, and we are going to hire a nurse manager to work with her to identify patients who are obese, make sure they get into clinic. Patients who are mildly obese will be followed by the general pediatrician, but kids who are moderately to morbidly obese will be referred to the endocrinologist for further workup, a nutritionist who will be at the clinic site, and social work as needed. And we are going to start actually an exercise class for children at the clinic. So I'm very, very excited about this program.
This is not an easy question, but it's easy for you. What can a parent do to help their child lose weight? It's easier said than done.
It's
right?
easier said than
Right,
done.
yeah.
And to give a little background, one question you ask is why are so many people obese? We really believe because there's a lot of access to high-calorie foods. The big drinks everyone has heard about, our mayor's trying to regulate that. And in the Bronx, there are very limited options for exercise. So for a parent, it's a couple things. One is really from a very early age, get their kids used to healthier foods. Have a 2-year-old walk around with carrots and munch on them. More fruits, more vegetables, less fast food, less fried foods, less oils. We want kids really filling up with fruits and vegetables, and very, very important, smaller portions. And one thing that sounds like a little funny, but no TV on at the dinner table.
Should the parents also do the same thing?
Absolutely.
Okay.
If a child is going to lose weight, it is not going to work if the parent has a refrigerator cabinet full of sweets they are eating. It has to be a whole family effort.
Okay.
Now, at what age should parents start worrying about their child's weight?
I hate to say this, but from birth.
Really?
We see infants who are massively overweight. We saw a 2-year-old recently who was 50 pounds. So just things that are rather shocking. We think from studies that maybe about half of infants, we're not sure the exact number, but a certain percentage of infants who start as obese will become obese as teens and adults. So given that, we are very, very cautious with parents about what they feed their infants. And a good example is breastfeeding kids have much lower rates of obesity. So we really, really encourage obesity.
Okay, perhaps now would be a good time to review the normal weight ranges for particular age groups, and for boys and for girls. What do you think?
So let me talk about that for a few seconds,
Sure.
because that's very, very important. When we see a kid for a general visit, or even for the inpatient, we take their height, weight, for kids under 3 years, their head circumference, and we plot it out on a graph called the WHO standards. From that, we can see if a kid is underweight, normal weight, or overweight. Really importantly, we look at what's called the BMI, which is comparison of height to weight. And that gives us a very important clue to whether a kid is overweight. If you're taller, you can weigh more. If you're shorter, you need to weigh less. So it's very important when you take your kid to see the pediatrician, family medicine doctor, or the specialist, take a look at those growth charts with the doctor. Have the doctor show them to you and explain them to you.
Okay. Very good.
Now, in terms of the healthy diet itself, you mentioned fast foods is probably one extreme.
Absolutely.
Is there a place for fast foods at all in terms of a child's enjoyment, or?
There is, but we tell parents to keep it down to once a week. And now a lot of fast food places have healthy
Right,
alternatives.
yeah.
But, when you walk into McDonald's and the kids are looking at the fries and the toys and the Happy Meal
Yeah.
versus the little package with apples, it doesn't happen.
Now, what does a healthy diet consist of? What would be your recommendations to parents?
It is smaller portions. You should not be filling the whole plate. Increased number of vegetables, fruits. If you have a piece of meat, it should be about that big, not that big. No fried foods. 3 meals a day, healthy snacks in between. And really importantly, we see a lot of kids. I've had a lot of children who are obese because they're drinking all day long juice and soda. I've had them lose weight by just cutting out the juice and soda. Everyone thinks juice is healthy. Most of juice is sugar. So it really is
that's
not
right,
healthy.
yeah,
Water,
yes,
water,
yeah.
water.
It's also a nice trick if they can eat slower.
Chew the food.
Yeah.
Right.
Yeah.
Is there a role for vitamins at an early age, and how do over-the-counter vitamins fit into the equation? Equation.
Right. Well, if a child has a healthy diet, no, they should be getting adequate vitamins from their food source. Unfortunately, we see children who their diet is so full of sugars and carbohydrates that they're not getting the vitamins they need, and at that point, we'll put them on vitamins, but push more for a healthy diet.
Yeah. Good.
And what is the balance between fats and proteins and carbohydrates?
What you eat should be no more than 30% fat content. Now, to really get good at that means you have to read labels, and a lot of our parents have not been taught how to do that. Yeah. So I don't sit and go over the numbers with parents. I tell them generally more fruits, more vegetables, smaller portions, less juice, no soda. And that usually does the trick.
Okay. At this point, let's pause for a short break, and when we return, we will continue our discussion, as well as take calls from you, our viewers. Once again, the number to call is 718-960-7241, That's 718-960-7241, and please call us.
In this year of neonatology, we recognize the extraordinary and successful life-saving efforts of our neonatal team. Every day, they are truly making miracles happen for the tiniest of babies.
We have saved thousands of babies throughout the years. There is nothing more satisfying than knowing that because of our care and attention, they can live their lives to the fullest as healthy young adults.
We care for each of our newborns as if they were our very own, including educating parents and assisting them in navigating the new journey with their child.
Seeing is believing, particularly for Norma Rodriguez and Raul Velasquez, the proud parents of triplets Nyla, Nilani, and Nayeli, successfully delivered by Bronx, Lebanon's high-risk obstetrics team.
Gently, very good. Okay, very good. Number three out, beautiful, very fine.
Triplets are a rare occurrence. The baby girls were delivered by a C-section in excellent condition. They received follow-up care in the neonatal intensive care unit because of their low birth weight.
And when it comes to follow-up care for these triplets, as well as other neonatal graduates and newborns, Bronx, Lebanon's pediatricians are making sure that they receive the necessary support.
During the first year of life, we check a child's growth, their development, and give all the required immunizations. It's a great joy to us that we're able to tell parents that they have a healthy child.
There are times when premature infants have swallowing, hearing, or breathing issues. That's when Bronx, Lebanon's ENT specialists are called into action.
Our physicians, audiologists, and speech-language therapists work closely with neonatologists in assessing these medically fragile babies. When necessary, we correct the problem and also instruct parents on using safe feeding practices.
Vision is equally important for newborns.
In premature babies, the retinal blood vessels are at risk of developing abnormally, which can lead to blindness. We are one of the first hospitals in the nation to offer laser treatment to correct this condition.
The bottom line is that Bronx, Lebanon is always there for its newborn patients and their families, as well as for the community. Its ER is a perfect example.
Our adult and pediatric emergency departments see more than 137,000 patients annually. We respond effectively to problems related to newborns, children, teenagers, and of course our adult and senior citizen population.
Bronx, Lebanon also continues to lead the way in anesthesiology, dentistry, family medicine, neurosurgery, orthopedics, pathology, psychiatry, surgery, radiology, nursing, and long-term care. Its Bronx Care Network, including a soon-to-be-completed 9-story ambulatory care facility, as well as a new life recovery center for individuals that suffer from chemical dependency, is fulfilling Bronx, Lebanon's role as doctor to the community.
Welcome back to HealthBeat. We come to you live on BronxNet every Monday evening from 6:30 to 7 p.m. Please call us at 718-960-7241 with any questions you have, and we will certainly do our best to answer them. That's 718-960-7241. Now, before we continue our discussion, I understand, Dr. Gumbs, that we have several calls.
Anna, do you have a question for us?
Yes. I'd like to know, when should you stop using formula, and does the use of formula contribute to obesity?
That's a great question. Kids should transition from formula to milk at 1 year of age. And yes, formula not per se, but we see a lot of kids. I see 1-month-old babies drinking 6 ounces of formula. It's much too much.
Really?
In the first 2 months of life, 1 to 2 ounces. So the issue is that the babies cry a lot. They're very, very demanding. Parents often think if the baby is crying, stick the bottle in the baby's mouth. That takes care of everything. And we have to do a lot of education with parents is not to feed formula on demand. With breastfeeding, we do not get that problem. Kids will kind of take as much as they need. So we have to be careful with the formula. That's
Thank you very much,
Thanks.
Anna. Yeah. We have Albert. Albert, you have a question for us. Albert?
Yes. My question is to the good doctor is, what does he think about these sports drinks that is on the market today, the Red Bulls and the 5-Hour Energy stuff, and what is his take on the supplementary diets, drinks and stuff like that?
etc. What do you think of?
And the dietary supplements. And I see, I'm an adolescent medicine specialist, so I see a fair number of teens coming in on supplements. You have to be very, very careful. First, Red Bull, absolutely not. I assume you mean in a teenager. High levels of caffeine and sugar can cause high blood pressure, can cause your heart to beat too fast, especially these kids are taking multiple cans of that a day, so absolutely not.
And they cause problems, right? Real problems.
Kids coming with high blood pressure.
Yeah.
Supplements, I've had kids coming with supplements. Some of them can be damaging to the kidneys.
Yeah.
So if your child is taking a supplement, a teenager is involved in sports, talk to your pediatrician about that.
We have another question? What?
Yes, I think we have another question.
Yeah. Could you tell me the name, please? No, I can't see. Just tell us. Tell us the name. Alexandra. I'm sorry, we have a little technical problem tonight. Can you give us your question?
Hi. Hello?
How do you do?
Hi, I'm good. I had a question for the doctor on the TV. My question was that my daughter grew out of asthma as a child, but now she's obese, and it seems like her asthma is acting up again. So my thought was, because I tried everything in the world to help assist with a weight loss program, and nothing seems to be helping, does he think that it's okay to have a 13-year-old start a vegan diet so that maybe it'll decrease her asthma symptoms?
That's a really good question. I've had patients on vegan diets. You can actually start a vegan diet at a much younger age, but you need to supplement certain vitamins. There might be difficulty in getting a source of iron and some of the B vitamins. So again, speak to your pediatrician. If your pediatrician says don't worry, speak to a nutritionist, because there are things you have to do on a vegan diet. But we have kids who are very, very healthy who do not eat any meat whatsoever.
But they have to supplement it, as you said.
You have to do some supplementation.
Okay.
It's not difficult to do.
What about a little exercise?
A lot of exercise.
Well,
and that's an issue, right, in terms of 13-year-old. That's an issue in the Bronx. We don't have a lot of places for kids to exercise. But speak to your pediatrician. There are some very good programs in the Bronx where kids can go on a regular basis to do exercise. Don't depend on the school. I have schools with no gym. I've seen schools with one gym once a week, not adequate, too.
Now, moving to a totally different question. One that we often ask our panelists is to share their respective career pathways with our viewers. In other words, what interested you in pursuing pediatrics as your medical career choice, and how did you even become interested in medicine?
I knew I wanted to be a pediatrician probably from a very young age, probably around 5 or so. Right. I had this incredible pediatrician, and he just was an amazing role model. He actually lived next door to where I lived, and he did house calls. It was not far for him to go, but he just was a role model. And I actually went back and thanked him a few years ago, and he was so pleased.
And lastly, can you just share the educational background of a pediatrician? What do they have to go through to become a
education. So 4 years of college, 4 years of medical school, 3 years of pediatric training. I did an additional 2 years in adolescent medicine because I practiced both pediatrics and a subspecialist in adolescent medicine.
Okay.
Okay. We have a good question for you now.
Very good.
When are prescription drugs recommended for childhood obesity? And perhaps you can tell us how effective they are for treatment.
Yeah, at this point, there are no drugs that are used for childhood obesity. There's a lot of research being done. There's a hormone called leptin that may be very involved in obesity and when people feel hungry or not, but that's something fairly far in the future. So in terms of medications for obesity, none. The only medication is healthy eating, exercise.
I'll let you continue the question, but I have Ruth. Ruth, you have a question for this good doctor. Ruth?
Hi, yes, Ruth. I do. I wanted to know, what are the signs that parents should look for in children that are bulimic or have any type of eating disorders?
Okay, so that's a very, very good question. Let me try to sum it up because it can be a fairly complicated technique. Bulimia. Kids will eat and then will run into the bathroom or their room and hide. That's the sign that a parent should look for. I'm not going to get more complicated than that. Or excessive weight swings, up and down, up and down. Eating disorders, very easy as a parent. weird, I don't know how else to put it, strange eating habits. They will eat very little. They will take their plate, move things around, separate all the colored vegetables. They will try to hide their weight loss in baggy clothes. They might become depressed and withdrawn. Loss of menstruation in a female adolescent. If you have questions about that, speak to your pediatrician about that to get more information.
Okay, thank you very much.
Thank you for that great question.
That's great.
Now,
That's a plan, right? Okay.
Another question we ask our panelists is to share their success stories. Perhaps you can give people with a childhood obesity problem a potential solution to the problem using a success story as an example.
I've had actually. I'm not going to point out a specific kid, but one thing that was interesting when this obesity epidemic started, we felt, how can I really make a difference in these kids' lives? How can I convince parents, kids to lose weight, to exercise?
Right.
And I've had in my career, especially over the last 10 years, I've had a multitude of kids just with counseling coming back to me every 2 or 3 months, seeing the nutritionist, getting them involved in exercise, getting the family involved to lose weight. So it's actually, you can really succeed with this as a pediatrician and more important as a parent.
What I heard tonight from you is that it's clearly not only the child's problem, but it's the family problem.
Absolutely.
And everybody
absolutely
should work to get it done.
Mom, Dad, if you have the Twinkies in the pantry, you expect your kid not to eat them, it's not going to happen.
Okay.
If you have a refrigerator full of soda and you expect your kid not to drink that soda, it's not going to happen. It has to be a family effort.
Okay. Okay. What are the medical complications associated with childhood obesity?
There are a multitude. The one that people have heard the most about and probably are most worried about is diabetes. I'm actually surprised we didn't get a call about that too. We're seeing more and more children and teenagers who are coming to us with diabetes. And they come in with weight loss, they're excessively thirsty, and they're peeing a lot. Very simple signs of diabetes. And that's what a parent should look for.
But I was going to ask you also, can these complications be reversed? And I got the feeling that part of the answer is no.
No, absolutely they can. A child who's diabetic with weight loss and exercise can reverse the diabetes, since most of it is related not to genetic part, but to being obese. We also see kids with breathing problems, worsening asthma, and kids who are depressed because they're obese and they're being, not treated well by other children. So there are a whole multitude of issues with kids.
Now, how do you and your staff interact with other physicians in specialty areas tied into the physical and emotional aspects of obesity?
The treatment of obesity is a team effort. So in the clinic setting, we have nutritionists who will see the patients on a very regular basis.
Right.
If families are dealing with issues that are making it difficult for the parents to take care of the kids, or they're stressed out, or they don't have adequate access to food, we will refer them to the social worker too. In addition, we have a excellent pediatric endocrinologist, Dr. St. Louis, who we refer the kids who are moderately to more severely obese, who can check them for diabetes and other things. We actually, some kids will have liver problems from being obese too. So,
okay. Last week we discussed asthma at the pediatric level. How is the Department of Pediatrics addressing what has apparently become an asthma epidemic throughout the community? But before you answer that question,
there's another question.
We have a call.
I love the calls. That's great.
Papi, you have a question
Hi, Papi.
for this doctor. Papi?
No, I guess we lost that
We lost
call.
Papi. Maybe Papi will come
Okay,
back.
okay. So you have the time.
So asthma, we have a very exciting program we are rolling out in 2014. I just hired a new pediatric pulmonologist who's excellent, who's very proactive. We're going to have a program for kids with asthma to be followed by a community health worker who'll be able to educate the parents and the kids, go out to their homes, remind them about appointments, get them in for the flu shots, get them in for the regular visit. What we find is kids with asthma, they show up to the emergency room when they're sick. We have medications to treat them before they get sick. We don't want them coming into our hospital. We want them on the
And you
medication.
have medicine also after they get the asthma too. If they
He's on the phone now, apparently.
Okay, Papi, you're on the air.
Hi, I was just wondering, how many times should I exercise a day, being that my asthma kicks in when I do this for about an hour?
Hi, Papi. That's okay. That's a very important question. And a lot of kids with asthma, they'll feel, oh, I can't do my sports. Parents will say, oh, I keep my kid out of gym because he or she has asthma. No, 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 no.
Should they take the asthma pump before?
It's very easy to treat asthma for people who are involved in sports. And there are about a third of athletes have asthma. You take your pump 20 minutes before you know you're going to be involved in gym or team sport. There's no reason for you not to be very, very active in sports. And if you're not sure what to do, speak to your doctor about that.
Obviously, from the volume of calls you're getting tonight, how do families and children make appointments to see you or your staff?
So they can call 718-579-PEDS and make an appointment. I'd be happy to see them. I also have other great pediatricians, both at our main hospital site and throughout the Bronx.
Okay.
Is there any evidence that obesity can be inherited? And depending on what you said before, it seems as if it runs in families. So, but still answer that question. What about the ethnic disposition of the patients? Is there ethnicity involved?
There are definitely genetic components. There are certain populations in the world who have high rates of obesity. The Samoans are one group.
Oh, yes.
But probably the epidemic we're seeing now is more related to exercise, eating, with a smaller genetic component. Maybe, I don't want to give a figure because I might not be right. But the genetic component is a small component.
Okay.
And what about by ethnicity? Is there...
Again, it's hard to tease it out. I would say in the Bronx,
depends on behavior.
again, with patients we see in the Bronx from a wide variety of ethnic backgrounds, it's really, most of it is behavior-oriented.
And in
So I want to
Minnesota-
give parents a positive message.
In Minnesota, we see different people. with obesity.
Don't worry about that, the genetic part.
Well, in the time remaining, Dr. Sherman, what I wanted to ask you is really to share with our viewers your recipe for successfully overcoming childhood obesity.
The recipe for that, as I said, very simple. Eat healthy, eat less fast food, no juice, no soda, or very little. And you have to exercise. You cannot lose weight without exercise. And it's a challenge for our parents in the Bronx. But there are as I said, there are several programs that have exercise programs. There's 2 Boys and Girls Club. There's 2 Pals in the Bronx. There's several community-based organizations that do have exercise programs. We're actually starting one at our MLK clinic on Franklin.
And it's a family sport to lose weight.
It is a family sport to lose weight. And you can also walk. Take your kids on the weekend and just walk around the block a couple times. You don't have to be involved in a traditional sport.
And on that note, Dr. Sherman, let me thank you for joining with Dr. Gums and myself on tonight's HealthBeat television program.
It was a pleasure.
And most importantly, let me thank you, our viewers, for tuning in this evening.
In the interim, if you, our viewers, have a question or need assistance, I encourage you to call our physician referral service by dialing 718-99-BRONX. That is 718-992-7669. Or you can refer to our website at bronxcare.org. Good night, and we'll see you next week.
In this year of neonatology, we recognize the extraordinary and successful life-saving efforts of our neonatal team. Every day, they are truly making miracles happen for the tiniest of babies.
We have saved thousands of babies throughout the years. There is nothing more satisfying than knowing that because of our care and attention,